Alright, this is part 2 of NG, and it's going to be suction and removal. To begin, I'm just going to pick up where I left off and measure the amount of tubing that I have left over. So I'm going to start at the edge of the patient's nose and measure all the way down to the end of the tube, which I get about 52 centimeters. Okay, and so now we're going to go ahead and move on to suction. Going to come over here and turn the suction on to intermediate or intermittent, and it'll be about a 20 to 40 range. I'm going to test it out and do that with my finger, make sure I can feel it. And since we've already confirmed placement with the NG tube on the patient, we can just go ahead and connect the suction to the NG tube, and hopefully this will have him feeling a lot more comfortable as it pulls this stuff off of his stomach. Okay, so after that, I would have went ahead and documented all of my assessment data on the abdomen and respiratory assessments that I did. I would document that the patient tolerated the procedure well, it was placed in the right nair with a 12 fringe tube, that we pulled off about 60 milliliters of greenish brown coffee ground like aspirate, and that we measured the length left over at 52 centimeters for further reference, and that he is connected to intermittent low wall suction right now. So the next thing I'm going to talk about is lavage, and that is when you instill 30 milliliters of water into, water or sterile solution into the NG tube to check and see if you have any residual left over, because we don't want that. And the way you do that is you take 30 milliliters, you're going to take it off suction, unclamp, and then instill the water, pull back, and check to see what the residual is, if there is any. And after that, you might have to give medications, and the way you give that in a NG tube is you're going to obviously crush the medications and give that with water in between each medication separately and at the very end. The next thing we're going to do is the NG removal. So this would happen after Mr. Smith is feeling a whole lot better, he's not having any more complications, and he's just a lot more comfortable. He doesn't have a distended stomach. So I would verify the order, not before entering the room, provide for privacy, assess Mr. Smith, wash my hands, and do my patient identifiers. But since we're already in here, we're just going to go from where we're at. So Mr. Smith, we're going to remove your NG tube today. It's a very simple procedure. The first thing I'm going to do is come over here and turn the suction off and then disconnect you. I'm going to take my catheter tip syringe and instill 30 milliliters of air to clear the tube and make sure there's nothing left. I'm going to get it ready to pull out. And all I'm going to have you do is I'm going to have you take a deep breath when I tell you to, and hold it, and I'll let you know when you can breathe again, okay? Alright, Mr. Smith, are you ready? Alright, I'm going to have you take a deep breath. Hold it. Hold it. Hold it. Alright, you can breathe again. Go ahead and clean you off there. I'm going to dispose of the tubing appropriately. And I would make sure Mr. Smith is feeling okay still. I would document that he tolerated the procedure well and that the NG tube was removed. And that's it for this video.